You know what happens on Tuesdays? We get to talk about our health. And remember that this is brought to you by the Bank Hospital. All right, so today we're going to be tackling a critical and potentially life-threatening condition. It's no other than heart attacks. Heart attacks, and often it strikes without warning, and it has taken so many lives. But it will be important for us to actually have some education about it to prevent it from happening, or to know what to do when it happens. But before we get into the conversation, let's check out this video, and when we come back, we'll be talking about heart attacks.
Like all other tissues in the body, the heart muscle needs oxygen-rich blood to function. The coronary arteries, which are wrapped around the heart, fill that need. In some conditions, fat can build up along the walls of the coronary arteries, reducing the supply of oxygen to the heart muscle. This buildup is called atherosclerosis. The three major risk factors of atherosclerosis are high blood pressure, high cholesterol, and smoking. This plaque can tear, causing the body's emergency repair system to rally. Blood components called platelets stick to the fat that is now exposed by the tear, forming a clot. The clot can completely block the blood supply downstream to the heart. Within a few minutes, muscle cells in the heart begin to die. This is a heart attack. The heart keeps beating but starts to lose its normal rhythm. If a larger part of the heart is affected, it can stop beating entirely. This is called cardiac arrest. Despite common misconceptions, a guy grabbing his chest and falling to the ground is not the typical presentation of a heart attack. Some people do experience the classic Hollywood heart attack, but the truth is, the symptoms of a heart attack can be much more subtle. Many heart attacks begin with only mild discomfort in the chest that intensifies over time. Other symptoms in the neck or the abdomen. Shortness of breath may accompany the pain, along with unexplained sweating. Time is critical in treating a heart attack. The condition can be totally reversible if diagnosed and treated early. Irreversible damage begins within 30 minutes of blockage, and half of deaths occur in the first 4 hours after symptoms begin. Doctors can perform an angioplasty to reopen the artery.
All right, welcome back. And now we just watched that video, and of course now we have a little bit overview of what heart attacks are. But right now it's time for us to get into the conversation with a doctor. And in the studio with me today is Dr. Mohammed Hafiz, who is an interventional cardiologist at the Bank Hospital. You're welcome, Doc.
Good morning, Grace. How are you?
I'm fine, thank you. How are you too?
Everything is good, thank you so much. Good morning for all the Ghanaians.
Thank you. All right, let's get straight into it. Heart attacks. How does it start?
Look, in the beginning, the heart is a muscle that is pumping the blood all over the body. So it needs oxygen to pump efficiently. So all of a sudden, what will happen? The blood flow to the heart will stop suddenly, and 10 or 20 minutes, the heart muscles start to die. Here we call it a heart attack, when the muscles start to die.
Yeah, so when it starts to die, it
Yes.
becomes a heart attack.
Yes.
So is there a difference between a heart attack and, what's the name? You just mentioned it in the video, but anyway. Yeah, a cardiac arrest.
Yes, a cardiac arrest, the heart muscle will stop completely.
Yeah.
But no, for a heart attack, just the blood flow to the heart is stopping suddenly, and the muscle will start to die after 20 minutes. This is the heart attack. But it's not a must when the heart muscles start to die. This means the heart will stop. No, it's not like this.
Right, so but what are the main causes of heart attacks? Because usually people just sit and have heart attacks. Nobody sees it coming. It doesn't give a warning, or maybe it gives warning, but we don't even know the warning. So what are the causes?
Look, heart attack can come to any person. But the heart attack is more commonly in patients over 50.
Over 50?
Yes, a man more than a woman.
Okay.
Hypertensive, diabetic, smoker. Having high cholesterol.
Right.
Another, the stressful lifestyle. You will find most of the patients who are having heart attacks are doctors.
Oh, really?
Really.
Because of stress?
Of the stress, yes. Another thing, lack of exercise, obesity.
Right. Obesity.
Unhealthy food, all this can lead to heart attacks.
Right, right. But are there signs? Like, do people have signs? Do let's say patients or people who have heart attack have earlier signs? Does something show you that, okay, look, I have a problem, I think I need to go to the hospital?
Look, heart attack is a life-threatening condition. So when it will come, it is something serious. It's not just a chest pain or some chest discomfort. No, it's life-threatening condition. So it should be severe. The crucial thing about heart attack is the chest pain. Actually, it's not pain. It is a discomfort, heaviness, something over your chest. It's not pain. We cannot say exactly pain. And this pain is not localized.
Yeah.
It's diffuse.
So it can be anywhere.
No, it will start and then it will spread, but it will not move from one place to another. It will spread.
Okay, so it might start here and just
No,
spread.
it will start in the middle,
Yeah,
in the
from the
center of
middle?
the chest,
Yeah.
and then it will go to the left
Oh.
and to the right. It can reach to your neck, the left shoulder, the left arm, the back. This chest pain, we will have with this chest pain sweating. This sweating will be different than any other sweating, that it will be cold sweating.
Oh, cold sweating.
Yes, this
Right.
is something, a good sign to suspect heart attack. Anyway, once you have this or you suspect having chest pain, you have to rush to the hospital.
Right, right.
And the best thing, you should not drive. Better,
You should not drive.
Yes,
Oh.
yes.
Okay.
Better to have a company with you to reach the hospital. Don't go to the hospital by yourself. Once you reach the hospital, the doctors there will do for you an ECG. They will do for you some blood tests.
Yeah.
And if they are 100% sure that you have a heart attack, they will take you to the cath lab. Within 30 to 40 minutes, the blockage will be opened and the chest pain will be off. 2 or 3 days, the patient will be back to his normal life.
Yeah, back to the normal life, right.
But the most important thing, to reach the hospital quickly.
All right, so when that happens, when the patient comes to the hospital and everything is checked and you're back to your normal life, can you get the heart attack again?
Look, if one had a heart attack, he is more prone than another to have a heart attack again.
Oh.
So that's why any patient who will have a heart attack, we are giving him aspirin for prophylaxis for another heart attack, because he is more prone than others to have an heart attack.
Another
Yes.
one, right. So now you said, men are more susceptible to have heart attacks than women.
Yes.
So are there different symptoms in either men or women, or is still the same symptom?
Almost the same, but women are different a little bit, especially if she is older a little bit, around 70 or
Okay.
80. She will not complain from chest pain. Mostly she will complain from shortness of breath.
Shortness of breath.
Yes.
Ooh.
All this will be suddenly. It will be within minutes.
Okay.
If you have shortness of breath within minutes, especially a woman, if she is diabetic, hypertensive, obese, around the 70, no, she has to go to the hospital immediately.
Immediately.
Yes.
Wow, that's interesting. In your life of being a doctor or a cardiologist, what is the youngest age that you've treated when it comes to heart attacks? Since you said it can happen to anybody.
Look, the youngest age I have ever seen was 26 years old.
26?
Yes.
And did the person have an underlying problem?
He didn't have anything at all. At all.
So it can happen to anybody?
Yes, but this is not how it is. I mean, if you will have 100 cases of heart attack, 80 or 90% from them will be hypertensive, will be old age, will be men, will be smoker, will have stressful lifestyle,
Yeah.
all this.
Yeah.
Very seldom it will happen like this.
Yeah, yeah. But let's talk about, you talked about smoking. Let's talk about alcohol. Does alcohol affect it?
Too much alcohol will affect. Too much alcohol. So if you are drinking alcohol, you have to drink to decrease your drinking a little bit.
Right. So I know heart attacks have been always have been there before we were even born. So it has always been there. What advancement has been made when it comes to treating heart attacks?
Look, before it was only medication. Now we have the cath lab. Now you can open the blockage mechanically. You will take the patient to the cath lab where you can enter his heart from his forearm or the groin. Painless, very safe procedure.
Right.
It will take almost less than 1 hour. The patient will be conscious.
Right. Oh, the patient will be conscious?
Yes.
So do you cut the patient?
No, at all. Just a small needle in the groin or in the forearm. And
In the
patient
groin or in the forearm?
It's easier than
And
the dentist.
it gets there to open it?
Yes, I'm telling you, the cath lab procedure is easier
Cath
than the
lab.
dentist. Yes.
Yeah.
We call it coronary angiography and angioplasty. It's very easy procedure, painless procedure, safe procedure. It will not take 1 hour. The patient will be awake, will be conscious, after 2 or 3 days, he will be back to his normal life again.
Right, right, right. So now, what lifestyle changes can people make to reduce the risk of having heart attacks?
Look, first of all, if you have a stressful lifestyle, no, stop this, please. Enjoy your time, go out with your family, go out with your friends, stay away from work. This is very important.
Stay away from work.
Yes.
So you need to rest most of
Yes.
the time. Yeah.
This is very important. Another thing, if you are not doing exercise, at least half an hour every day. It's a must.
Half
Diet.
an hour every
Yes.
day.
Yes.
Every day.
You need half an hours every week.
Oh, so yeah, yeah.
You need, yes, you need 2 hours and a half every week for
Yeah.
exercise. The diet, eat healthy food, eat vegetables, eat fruits. Stay away from smoking.
Right.
If you have hypertension, diabetes, high cholesterol, you have to do control, not any control, tight control.
Right. Tight control.
Yes.
Yeah.
For all this.
Wow. So now let's talk about stress. How would one know that he or she is actually stressed? Because from the patterns that we see these days, a lot of people do not realize that they are stressed. They just say, I'm sick. Oh, I'm sick. Or some people just keep going until the breakdown. So how will you know that, okay, I think this is stress. I think I need to rest. I think I need to stop. Because like from what it is right now, even like talking to some other doctors, a lot of young people have gone to the hospital and, you know, from stress turns to maybe stroke, it turns to something else. So how will somebody know that, look, this is stress, I need to stop?
Look, when in stress, you will never think about anything that you have to enjoy. You will not enjoy your life. Once you are not enjoying your life, this is stress.
Wow. Once you are not enjoying your life.
This is stress.
Okay. Okay, I have a lot of things to say, but okay, that's interesting. Now, anyway, are there preventive measures that we can actually take apart from, you know, exercising and also eating well?
I told you, you have to, if you have any medical risk factors for heart attacks, you have to tight control. If you are not doing exercise, you have to do exercise.
Right.
If you are obese, you have to lose weight. If you are not eating junk food too much, you have to decrease. You have to stop this. You have to eat healthy food,
Right.
vegetables, green vegetables, fruits,
Right.
as much as you can.
Right. Right.
Stay away from stress.
Okay. All right. So now someone already has heart attacks and then they come to the hospital and you do the treatment. What is the post recovery like? How long does it take you to fully recover? Or would you just get up and say, oh, okay, I'm done from the hospital and life continues?
If you comes to the hospital in the perfect time, you will not stay in the hospital 2 or 3 days maximum.
Okay.
Within 1 month of a heart attack, you will come back to your normal life. 1 month
Right,
only.
right,
Just
right.
go in the proper time.
Right. And how important is, let's say, follow-ups and management? Like after you go to the hospital or after you get treatment, is it important to still come back and check yourself once in a
Yes.
while?
Look, most of the patients, when they will have a heart attack, they will then become, they respect everything. They will respect their lifestyle.
they respect their
yes, they will do
lifestyle, yeah,
exercise.
yeah.
So they will take care once they have a heart attack. We need to check them after 3 months, every 3 months, just for checkup to see how it's going on.
Right, right.
That's it
right.
only.
Wow. So what advice would you give to people watching now and, you know, trying to prevent and maybe if they have already gone through that phase, what advice would you give them?
Look, I'm here in Ghana since 2 years now. I saw many patients for heart attacks, but the only thing that they are always coming late. So
They're always coming late.
Yes, 90% from the patients I saw here in Ghana, they are always coming late. So it is difficult for the patient and it's difficult also for the doctor.
Right.
And the recovery will not be that easy. So my advice for anyone here in Ghana who will suspect to have a heart attack, please, please, please don't hesitate and rush to the hospital.
All right. Okay. All right. So now we are going to actually invite Ann Rita Solano, who is the business development consultant at the Bank Hospital. She is going to tell us what they are actually doing right now when it comes to awareness and helping people when it comes to their heart and, you know, anything cardiology. Hi, Anne.
Hi, Chris.
How are you?
Hi, Doctor.
Hi,
How are you? Thank you for having us again today.
Thank you.
So, just to continue on what
Yeah.
Dr. Mohammed is saying, you know, prevention is actually very key.
Yeah.
A lot of people are coming too late. and part of prevention is actually being screened. So we are so proud to have one of the most, internationally acclaimed interventional cardiologists with us in-house.
Yeah.
And Dr. Mohammed is going to run, we all can see on the screen,
Right.
he's going to run a cardiac camp
Yeah.
that is going to take place from the 2nd to the 30th of September
Right.
during, the weekdays from 8 a.m. to 11 a.m. So people, the audience who is listening here, anybody who has the risk factors, age 40 plus, mainly men, but also ladies, they are hypertensive, they have diabetes, they're smoking, they have high cholesterol. The symptoms would be the chest pain or, similar to that pain that is running through, difficulty breathing or palpitation.
Right.
So they need to come for this camp that is proposing a few tests: fast blood sugar, lipid profile, an echocardiogram, and a consultation with Dr. Mohammed.
Right.
So the number to call is 0302 739 373. And we'll see you at the hospital.
All right, thank you so much. And
Thank you.
I think this is actually a great initiative because it's very important that we keep the public aware of everything that is going on, because most of the times people do not realize how serious these things are, and that's why he said they actually come late, because there's no awareness and there's no treatment. But I think I like what the Bank Hospital is doing. So ladies and gentlemen, I think that you should take the opportunity and go check your heart, because your heart actually matters. So walk into the Bank Hospital next from 2nd September to the 30th of September, Mondays to Fridays at 8 a.m. to 11 a.m. and go check yourself. Go screen your heart, you never know what's happening there. Sometimes we just feel things and then think it's okay. Oh, nothing. It will just go with a little bit of paracetamol, but you don't know if it's serious. So go out there if you're age 40, hypertensive, diabetes, you're a smoker, or you have been suffering from high cholesterol. And if you have symptoms of chest pain, difficulty breathing, and palpitation, this is for you. You really do not want to miss this. Thank you so much, Anrita Solano, who is the Business Development Consultant at the Bank Hospital. And also a very big thank you to Dr. Mohammed Hafiz, who is an interventional cardiologist at the Bank Hospital. And remember that this conversation was brought to you by the Bank Hospital. Your health matters and your heart also matters. So please, 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 please take care of yourselves. Go out there and screen yourself.